intention is that we will have a bit of a short quiz where you just have to answer through the chat or shout it out if you want to. And then we'll go through some of the main points that are required to be included in your research proposal if you are in fact doing an observational study design for your research study. And then after that, if you have some time, perhaps we could do like an informal consultation where you can ask questions about your own research proposal, and hopefully the others can benefit from that sharing session as well, if that's okay. Everyone okay? Lady? All right, something in the chat. Let me just see what's there. Okay, oh, that's just the attendance. All right. Yes? Did somebody want to ask a question? No? Okay. All right. So I hope you can see my screen. Okay. Oh, the answer that came out. Okay, so what I'd like you to do, I think it'll be a bit easier if you just shout it out. So turn on your mic and shout out the answer as opposed to the chat room, because I probably won't look at it. So for example, if your study has a title that sounds a bit like this, risk of developing lung cancer among smokers and non-smokers in an urban Malaysian population, a 15-year follow-up. So please shout out the type of study that you think this would be.
A cohort study.
Cohort study.
Okay, all right. Anyone else?
Retrospective cohort.
Okay.
Observational
All right.
retrospective
Or
cohort.
longitudinal.
No,
Okay.
it's a prospective cohort study because it's mentioned a 15-year follow-up. We are following
Okay.
patient, so it's a prospective cohort study, longitudinal study.
All right. Okay. So the answer is prospective cohort study. Correctly, because you're doing, it says in the title. So you're basing on the title. So obviously titles are not comprehensive enough to give all the information, but it will hint as to what type of study design it is and what are the methods of data collection. So by this title, it sounds more like a prospective cohort study because they're following people over 15 years. So the rationale is that you're measuring exposure, which is measured first, and then the outcome lung cancer is measured afterwards because of the phrasing risk of developing lung cancer, meaning that there are no cases in this particular study design. Okay, all right, let's go to the next one. Prevalence of anxiety and depression among university students during the post-COVID era in Malaysia.
A cross-sectional study.
All right, specific cross-sectional study?
Descriptive.
All right, anyone else want to take a guess?
The descriptive cross-sectional study.
Mm-hmm. All right, so the answer is descriptive cross-sectional study. So the hint there is from the word prevalence. So prevalence is what you normally measure in cross-sectional studies, but because they're looking at prevalence as a descriptive statistic, so they're measuring anxiety and depression, so there is no phrasing that implies that there's going to be looking at the relationship between anxiety and depression or whatever it is, or COVID and anxiety, COVID and depression. So because it doesn't imply any analytical statistics, therefore it is considered as a descriptive cross-sectional study. Okay. The next one is occupational exposure history among women diagnosed with reproductive disorders in Klang Valley hospitals. Anyone want to take a guess? Okay, bye-bye.
Can you please
Anyone?
define what does it mean, occupational exposure history?
For example, work stress or exposure to certain ergonomic factors.
I'm thinking of
or in this case,
retrospective.
retrospective, okay.
Retrospective cohort study.
Okay, any other guesses?
It's a case control because I think so, because it is mentioned that the woman diagnosed with reproductive disorders, the case is already mentioned here. So I think it's a case control study.
Okay. Very good, Ismail. So it's true, it is a case control study. So based on your justification, very true, because it highlights that you are focusing on a study population where they have already been diagnosed. So they are diagnosed with reproductive disorders, and your purpose is to look at their history. In this case, occupational exposure that is related to reproductive disorders. So when you look at history, automatically you know that it's something retrospective. So you have a choice between either retrospective cohort or case control. But in this case, because you already have the cases, so therefore it is a case control study. Okay. All right, the next one, correlation between pesticide usage and cancer incidence rates across 10 agricultural regions.
Cohort study.
Okay. Anyone else?
Because we have the exposure and we want to see the outcome.
Okay. How about, does it mention anything that implies that there's a comparison across different places?
Western agricultural regions.
Okay. Remember in the descriptive observational studies, there were 3, the last one that we covered.
Because it is mentioned that the agriculture region, so we are specifying the any localized area. So I think it's ecological cross-sectional study, observational.
Okay. Observational?
Observational ecological cross-sectional study.
Okay. Sister, you're on a roll. You're doing very, very well. So yes, it's true, it's an ecological study. As soon as you see in the title where they are comparing or looking at trends or patterns across geographical areas, whether it be across hospitals, countries, cities, regions, automatically it's an ecological study. So I have to highlight this because I think I overlooked it in my talk this morning. But basically, ecological studies, even though it's under the descriptive, but people tend to also try to come up with hypotheses looking at the trends across the region. So they looked at pesticide usage perhaps in the regions and also cancer incidence across the regions. And from that mass data, they want to look at the relationships. So basically, ecological studies shouldn't actually be parked under the descriptive. It should be parked more under the analytical. But because you're dealing with group level data, I think that's why it's classified as being a descriptive study as opposed to analytical, because it doesn't really involve you taking consistent primary data or even consistent secondary data, because you do realize that there are variations in how the data was collected in each of the regions. Okay.
So
all right, I think it's yes.
I want to ask to the ecological study. So can you write it like descriptive cross-sectional ecological study, or we just write ecological study? Do we have
Okay, so when it comes to titles, I don't see people writing observational, descriptive, or analytical. They will straight away mention the study design. So whether it be case control, ecological, case series, cohort, they will straight away mention the specific study design.
No, I'm not asking in the title. In the study design, when we in the same title, what we write in the study design, it's only the ecological study, or we have to write that it is a descriptive, analytical, cross-sectional ecological study, or just the ecological study?
Okay, it depends on the type of analysis that you plan to do. If you feel like it's going to be more analytical, for example, looking at relationships, then write the analytical analytical ecological study. But this applies to not just ecological, but the rest. If your intention is purely to describe, for example, correlation, then mention there that it's a descriptive cross-sectional study. Is that okay?
Okay, thank you.
All right. No worries. Okay, I think this is the last one. Association between fast food consumption and obesity among adults in Kuala Lumpur.
Observational analytical study.
Okay, specific study design?
It's a cross-sectional study.
I think it's depends.
Okay.
Can it be cohort?
Okay. Anyone else?
Yeah, cohort. Cohort
Okay.
study.
All right. Anyone else?
I think it's a cross-sectional study because it is not mentioning that how long it is. We cannot say that it's a cohort study because mostly in studies the duration is mentioned. It is just analytical cross-sectional study. I think.
Okay, all right. So the answer is analytical cross-sectional study. Okay, because one, you've already mentioned that there are two variables, which is your fast food consumption and obesity. So these are your exposure and outcome variables. And you also want to look at the relationships. So by default, you're doing analytical because it's a relationship between exposure and outcome. Plus it's cross-sectional. Now, it's good that I subconsciously put this at the end of the quiz. Basically, there's also another thing that you have to bear in mind, especially with your research titles, if they are ambiguous like this. So whoever mentioned cohort, it is not wrong, okay? Because if you design the cohort in such a way that you enroll people who are healthy and then somehow follow them over 5-10 years to see if they develop obesity or not. So obesity, correct me if I'm wrong, is not, it is a disorder, but it's not a disease, but people will say it's a disease per se, but it's obviously a health outcome. So if you design the cohort study in such a way that you recruited healthy people, or maybe, for example, you recruited school children and decided to follow them for 10 years until they reach adolescence or whatever, young adulthood, and wanted to see what is the effect of fast food on their development of obesity. It is also possible. So one of the things that you have to also grasp is that your research title actually can be studied through different study designs. So how do you choose the study design? One of the easiest way to do it is to determine what resources do you have. So if you have an ample budget and you have ample time to conduct the study, a cohort study would be relevant in this context. But if you don't, then you can do a cross-sectional study. So at the end of the day, it is very, very possible that when you defend your proposal, somebody might say, hey, I think you'd be better off doing a cross-sectional instead of a cohort, or you'd be better off doing a case control instead of a ecological study, for example. Because you can look at it from different perspectives. But at the end of the day, you are conducting the study. You know what your Gantt chart or your timeline is. You know whether or not you have access to a grant, etc., and data sources, etc. So that will help you to determine which study design is the most appropriate for your title. Okay, so that's what I mentioned earlier. When it comes to cohort studies, it's unlikely that students will do a cohort study in their PG studies because it's just not time efficient. But this is to say, if that is the case, then by all means do. I cannot dictate what is wrong and what is right. So it just requires a lot of deep conversations with your supervisor to see what is logistically sound and feasible to conduct. Okay, oh, it's not the last one. So there's another one. Incidence of type 2 diabetes among adults with a history of gestational diabetes, evidence from National Health Registry data from 2010 to 2025.
It's a prospective cohort study.
Anyone
Because
else?
we are going
Cross-sectional study.
Okay. Oh, I think it's raining in Kuantan. Anyone in Kuantan? Seems to be thundering right now.
Cohort study, Doctor.
Apa dia? Retrospective?
Retrospective cohort study.
All right. Okay, so the answer is retrospective cohort study. So what are the hints or the keywords in the title? One, anytime you see the word incidents, automatically
The
it's
year
cohort.
of the study.
Oh, you take the year of the
Yeah.
study. Boleh juga. Because obviously when you talk about 2010, 2025, it's pretty much in the past. 2025 is almost ending. Plus the word incidents means that you are identifying new cases. So whenever incidents can only be measured through cohort studies. Now to determine whether it's retrospective or prospective, one is the timeline. Because it's 2010 to 2025, unless you go back in time, this is more likely a retrospective cohort study. If we change the title, so it's incidence of type 2 diabetes among adults, forget about the evidence from National Health Registry data, and I put there in brackets 2025 to 2035, then it would change into a prospective cohort study. Okay? All right, so everyone okay with it so far? I think this is the last one. Okay, all right, so that's the last one. So let's go into the last part, which is basically I want to share the key components that are compulsory for you to include in your research proposal. So different to experimental studies, I believe when Prof. Mutt was different, I don't believe because I don't know anything, but I think because Prof. Mutt, based on his background, he's very much into lab work, lab-based research, experimental. So the way that the proposal is written up for an experimental study is very, very different. Even if you're doing an experimental study, which is like a more ethical clinical trial, it also has different components as part of the research proposal. So I just want to focus on the observational studies and the elements that are compulsory. So first of all, you always have to specify the study design. So in the research proposal, you obviously have the first part, which is your introduction, problem statement, significance of study, research objectives, research questions, hypothesis. So these are just components that are required in the methodology section of your research proposal. So the first part of research proposal has to mention the study design. So you have to give the justification or the rationale behind why you're using that study design. Because, like I mentioned, a research title can actually imply several options of study designs. For example, before this, we talked about cohort, choosing between retrospective, prospective, choosing between case control or cross-sectional. So you have to decide and justify in this section why you chose that study design. Often the cases is that students will say, this is most commonly used if it's to do with my final year project students, where they have very little time to do an FYP. Their justification would always be conducting a cross-sectional study because it's the most efficient study design to be completed in the time given to them, which is less than a year. So that's perfectly fine. But if they were given the time and the budget, they could probably do something that's more non-case control or a prospective cohort. But because they don't have that, that's why they end up picking the cross-sectional. So justify why the design is most suitable, because your examiners will ask you this. Number two, study site. So I've had the privilege of supervising students who are from other countries other than Malaysia. So it's very interesting when they share maps of where their study site is, whether it be Nigeria or it be in Gaza, for example. So for your research proposals, I would encourage you to put a map. Even if you're a local student doing a local study, put a map. Okay, so a map to tell people, for example, if you're doing the whole of Malaysia, to make your results, your findings generalizable, it is appropriate or relevant for you to ensure that every state in Malaysia is represented in your final sample. So if that's the case, put a map of Malaysia and perhaps, I don't know, an arrow in each one that says this is data will be collected from hospital, whatever it is, kat Kedah, dekat Pahang, dekat ni. So at least people know that you're covering the whole geography. If you are doing multi-site, specify how many sites that you're looking at. So there's specific formulas for that. Name the hospitals, the clinics, the districts, the communities. If you're collecting data for a retrospective study, then mention the existing data systems as well, alongside with the study site or the name of the hospital. The third one is study population. So obviously your target population is where you're going to generalize your findings, but you also have to specify your study population. So this is a subset within your site. So you have the whole, for example, you have the whole of Malaysia, you have all the states. So Malaysia is your target population, but your study population would be a specific subset within each state, for example. Okay, and how do you determine the subset? Is through describing what is the inclusion criteria and describing also what is the exclusion criteria. And that leads on to something here, which is called the sampling frame as well. So basically you have to mention the inclusion exclusion criteria, Also estimated population size. So best if you can get the statistics from, let's just say, Department of Statistics, kalau Malaysia. If it's other countries, you may have a similar access to different websites or databases. So you can mention that as well. Or you can refer to research articles as well if you want to estimate a specific population size. The next thing, which I can't cover, which will be covered in another day by Dr. Nurulwahida, is the sampling method. So just a light approach to this, or a light introduction to this, there are two types of sampling. There is the probability sampling or the random sampling, and then you have the non-probability sampling or non-random sampling. In an ideal situation, and in order for you to fulfill the assumptions in statistical analysis, you should always go for the probability sampling, which stipulates that every individual that you want to recruit has an equal chance of being recruited into the study. So meaning that there is no bias in a probability sampling or random sampling. Okay, so ideally, if you want to minimize bias, you should only employ a probability sampling, where that includes simple random sampling, systematic random sampling, stratified, and cluster randomized. So these are 4 options of probability sampling. However, in my experience as a supervisor and a supervisee, it is very difficult to conduct a random sampling purely because of this one thing here, which is called the sampling frame. So the sampling frame is basically a list of people or a list of potential participants that you can recruit into a study. So for example, if you're collecting data from SASMEC, UIA's hospital, so you would have to get access to the entire, for example, on diabetes, you would have to get access to the entire list of clinically diagnosed diabetic patients in the hospital. Do you think everyone has access to that information?
No.
No. It's very difficult to get that access because of, the simple ethical reason, which is privacy and confidentiality. So it's very difficult. So that's why if you are conducting a study with a hospital setting, clinical setting, or any population where you need to get official access, then you need to get somebody on your team who is a gatekeeper. So that gatekeeper will give you or enable you access to that particular population. So in a very simple way, if you wanted to, if anyone's from Kota Sas, so Kota Sas is a residential area where they have many precincts. So for example, I'm from P1. If somebody wanted to conduct a survey on P1, meaning they wanted to recruit every household that was in the precinct 1 of Kota Sas, they would have to go through the Ketua Kampung, who is the gatekeeper, or I don't know, for the non-local students, we have like a chairman, apa tahu, Ketua Kampung apa? Village head. Boleh ke? So basically somebody who represents the precinct who will enable you or facilitate you to get access to the residents. So basically in my precinct, we have Encik Hussein. So you would have to get permission from him, official permission with, like a document, that's signed by your supervisor, or you can bring your supervisor and say, hey, Encik Hussein, we would like to do a survey on this precinct. Would you help facilitate us or give permission or at least inform the residents that we are going door to door, because we live in a world of scammers, right? So we need to get official permission to access them. So in that sense, it's quite easy. Obviously, you have to deal with the residents, whether or not they're willing to cooperate or not and allow you to survey them. But in the context of like hospitals or even schools, it can be very difficult to get access to those individuals. So just because you can't get a list of people, that's where people find it challenging to conduct a probability sampling. Now, why do I enforce a probability sampling? Simply because of that attempted thing that I tried to do this morning, which is, remember you have population and sample. And then in order for you to say with confidence that everything that happened in the sample also happened in the population, you have to have this generalizability power. Okay, so you can only have a better generalizability power. In other words, you can relate the sample to the population if you have a probability sampling. Why? Because probability sampling minimizes bias. Okay, now, more often than not, people can't do probability sampling. In my school of thought, which is probably short sendiri lah, I always ask students, propose for a probability sampling. And then if it doesn't work out, then troubleshoot and end up doing a non-probability sampling, which includes a convenient sampling. So a very simple example of a convenient sampling is you have a questionnaire, you just viral that questionnaire link, the Google form, to everyone. So in other words, you just share it with everyone that's in your contact list. You share it with, friends, family, etc. That is an example of convenient sampling, which is not random. So because it's not random, it means that you have a lot of issues with bias, and therefore your generalizability power is actually lowered. So when it's lowered, then it kind of reduces the credibility of your conclusions. Okay. So me saying this doesn't mean that when you can't do probability sampling, you cannot do anything else. No, it doesn't. It just means that if you end up having to do the non-probability sampling because of logistic reasons, then you just have to be very humble and be very aware of the bias that was part of your methodology and part of your data collection, and have to come up with what were the what were the ways that you troubleshoot or manage them, and also declare them in your limitations. Okay, so my number one thing to do when you are sharing your findings is to be humble and realize that your proposal or your data collection was not flawless at all. Okay, Dr. Nadia, you wanted to ask a question?
Yes, Assalamu alaikum, Dr. Wahida. I
Alaikum
want to
salam.
ask, uh,
Mhm,
my research article, I'm taking the non-probability sampling, that is purposive sampling. Like I'm taking
mhm,
the already patients who
mhm,
are fulfilling my inclusion criteria of
mhm,
having disease otitis media for
mhm.
any reason. So, as you told us that it's better to go for the probability sampling for the research, it's better.
Mm.
What about my sampling? Because it's having strict inclusion criteria, and I
Mhm.
have to take the only the patients who are already been diagnosed for these diseases, and I want to know the consequences of that particular disease in our population. So,
Okay.
is it good for my PhD study to go for the purpose? Because otherwise, when I thoroughly looking at my research, so I couldn't find that I can make the sampling frame and make the sample in probability sampling.
Mhm.
So, what's your opinion? What's your suggestion? What to do with
Okay.
my research?
No, the research, you say it like as if you can't do your research. You can definitely continue with your research. Purposive is definitely a non-probability sampling. Very common if you're doing a qualitative research methodology. Now, if you have a purposive sampling, continue. The reason why I say that it's difficult to do a probability sampling is because you need access to the sampling frame. So unless you do what is like, okay, if somebody has otitis media, then do you have access to the entire list of people who have been diagnosed with OM, sorry. If you
Yeah,
do,
yeah, I talked to my site supervisor in here in Emirates, and
mm-hmm,
she's saying that whoever is diagnosed in our setup, whether in emergency department or OPD,
mm-hmm,
outpatient department,
mm-hmm,
or in ENT, or even the OPDs where walk-in patients are there,
mm-hmm.
we can include all of them. But I know it's a little bit difficult for me to get the access. Once I'll having the paper from my university like IIUM, to allow me the access of data through my site supervisor. It will be convenient for me. I will collect under one roof. I will collect the data from OPD, from emergency, and from ENT. Like
Okay.
from the three sides, it is possible. I know it's a difficult, but once I'll get the access, I can do that. And I just want because you are mashallah, you are biostatician and you have very strong grip on this subject. So I want a best suggestion for you. I want to like go by holding your hand in my
Okay.
research. That's why I want to confirm it. Is it okay now for my research
It's it's
that?
it's okay. I mean, there's no rules that says, oh, if you do non-probability, you can't do the study or you can't do your PhD or your master's. There's no rule against that. Okay, so I see a lot of situations like this where, especially if you're talking about health data or health access to health populations, they don't they can't necessarily get access to that list. So what they normally do is that on a daily basis, they will screen their patients and they will scrutinize the patient's characteristics according to the inclusion-exclusion criteria. So I think, if you have very specific inclusion and exclusion criteria that requires you to screen even outside of the sampling frame, then I believe purposive sampling is okay. Okay. But if it's a very I'm not going to say it's simple diagnosis or a simple case description. That doesn't require such technical inclusion-exclusion criteria, other than things like can't speak English or has mental health problems or has other comorbidities. Then you can try to do the non-purposive, which is the more probability sampling, if you can get access to the sampling frame. So Nadia, you have my blessing to do the purposive sampling, but
Thank
obviously
you.
discuss with your supervisor first to see if
Okay.
it's because
Thank
at the end of the day, if you're doing something so specific, then obviously the sample size is going to be smaller because there's so a specific of a population that you're focusing on, right?
Right.
Okay.
And one thing more.
Mm,
What are, as right now I am in touch with my supervisor. We more than oftenly having meeting at the hospitals.
mm-hmm,
The thing is, uh, I asked her to get the at least the previous 1 year data regarding otitis media and
mm-hmm,
like ETD, na? Eustachian
mm-hmm,
tube dysfunction, to draw
mm-hmm.
the exact sample that you that is agreeable by you. So what are the minimum criteria, minimum sample size for because we are dealing with the three things, that is otitis media because of
Mm-hmm.
ETD dysfunction, and ETD
Mm-hmm.
dysfunction it can be because of sinusitis, and sinusitis itself is chronic, acute, and subacute, and
Mm-hmm.
allergic rhinitis, right? So you can say general term nasal diseases. The thing
Mm-hmm.
is, how much you expect the minimum sample size will be sufficient for my this research?
Okay, because I don't want to indulge too much because I want to save this for Dr. Nurasida later on, who will focus on the topic of sample size calculation. But there are two approaches. One, looking at the perspective of the resources that you have. The other is looking at it from the statistical perspective. So I don't know whether this is relevant now, but usually they would require a minimum of 30 to conduct the study. For a PhD level, I don't know if there are specific expectations regarding sample size. Because I think the consensus is if it's a small sample size, people will wonder whether or not it has enough generalizability power. So it all goes back to, I don't think 30 would be the minimum. I think you can get more, but I have no idea about your site and your population and how many actually fit in your eligibility criteria. But is it okay if you pose that question to Dr. Norasida later on?
Inshallah. I actually don't have a connection with her, but definitely once I'll get connection with her, I will definitely ask her. But the thing is, like as you said in your last this lines, the more the sample size is, matlab, adequate sample size will be, I think, the more effective results I can get. Otherwise, for the smaller, below 100, I don't think
Definitely.
that will satisfy myself.
Definitely. So
So I
it
would,
it goes back to the magnitude of your study as well as the PG
yeah.
status of it, and
Hmm.
also the population. But if you're dealing with something like a rare disease,
Mhm.
or a rare outcome, by default you already started off with a small target population.
Mhm.
So people can't say, oh, your target population is 100, so therefore you need to get 200 in your sample size. Obviously, that doesn't make any
Hmm.
sense.
Hmm.
So you have to try and find the best formula that says, okay, you have a target, or that's 300. What is the bare minimum that you can include or recruit into your study?
Because
Okay.
Dr. Vaida, see these diseases, otitis media and rhinosinusitis, it's a very common disease, and
Mm,
everybody is taking it so normal. And
right. Okay.
every now and then ENT OPD is filled with these patients. So I was thinking to get a proper sample size that
Mm-hmm.
can cover that can cover the what you say, like it can give me the good result, the
Yeah.
authentic result.
Yeah. The
Instead
the
of
fact that
few
you're
sampling, I know the smaller the sampling size, it is more easy for me. But I don't want easiness for me. I want a thing that is valid for
representative.
the, yeah, presentable, valid with authenticity. So
Mm-hmm.
for that, I want adequate sample size, and I'm really working over it to get how much sample size would be there. The
Mm-hmm.
the subgrouping of the sample which I am thinking of making over here in Emirates
Mm-hmm.
is the two groups. One is the Emiratis, the Emirate-based native people, and the
Mm-hmm.
non-Emiratis who are working over here, but from different nation. Is it okay
Okay.
now?
Now,
Subgroup is okay now like this?
um, it's okay, but now you've introduced a different variable. So Nadia is my potential PG student as well. I'm as a co-supervisor. So Nadia, is it okay if we discuss it in a
Okay, okay,
private
okay.
room?
Right. Done, done, done.
Okay,
Thank
all
you,
right.
thank
No
you.
problem. Okay, Sister Izian, you want to ask a question?
Sorry, doctor, I want to ask. My study is using sample from suspect laboratory. About
Mm-hmm.
about map you mentioned before. Do I
Mm-hmm.
put suspect map in my
Oh,
in my proposal, or do
tak, tak,
I
tak.
need to
Tak payah.
doctor? Tak payah. Oh,
Kalau
okay.
so tak tahu ya, no, 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 no. I was thinking more of like, there are some people who have studies where they focus on geographical areas, kan? So if you are doing a study where it's looking at a establishment, like for example, clinic or hospital, then you don't need it. The most that you probably state is if you have suspect, okay, which units that you are going to be sampling from. Tu je.
Okay, okay, doctor. Thank you so much.
Okay, all right, no problem. Okay, so moving on to the next one. Okay, so after you determine your sampling strategy, and then what is it, sampling method, sampling frame, then you have to determine the sample size. So you have to state what formula that you are using and its justification. So if the idea is to compare, then there's a specific formula. If the idea is to do a correlation analysis, that is a specific formula. If you're looking to measure associations in a chi test, it has a specific formula. So nowadays we have access to a lot of not technology, but sites where they facilitate this determination of sample size. So there are things like G-Power. I think some of you have heard of it, and there's OpenEpi as well, where you just plug in the values that are relevant for your sample size calculation. So what I've seen in the past is that in the software, it will ask you, okay, are you comparing means between 2 or 3 groups? So essentially, your main analysis is like an ANOVA, it will give you the most suitable formula to calculate the sample size that will allow you to do an ANOVA test or a t-test or a chi-test or correlation analysis. So make sure that you mention the formula that you're going to use and its calculations, reference the software that you're going to use. And also, if you're doing survey research, meaning that you're collecting information through questionnaires, also factored in to the sample size calculation is something called 10 to 20% non-response. Now, if you have ever completed a questionnaire, or that's the reverse of it, have you ever received a questionnaire and then do you often reply or complete the questionnaire terus, as in straight away? If you ever get a link to a questionnaire in your WhatsApp or in an email, do you respond straight away by completing the questionnaire?
Depends on
say-
the topic.
Aha, very good. So honestly speaking, and I am also guilty of it, it's very rare that I will respond straight away, even if it's a interesting topic, but the interesting topic will be a good motivation. But it's very likely that a lot of people that you approach to do a questionnaire through the online method, they will ignore it in the beginning, whether it's email or WhatsApp. Why? Because perhaps they opened it in the most in an inconvenient time, or perhaps they didn't find it interesting. So, for example, if you calculated a sample size that said 350, so you distributed your questionnaire to 350, either probability-wise or non-probability sampling, it's unlikely that you will get 350 back. So what you do is that you add on 10 to 20%, so that anyone who did not respond will be somehow compensated by that 10 to 20. So for example, instead of 350, excluding that 10 to 20% non-response, you actually increase it to 400. So that at the end of the day, your target sample was 350, right? But because of non-response and the compensation, you do eventually get 350. Now, this is something I learned in my PhD. Not that I did it, but a fellow student, asked the professor, if I'm doing probability sampling, which means that I have to specify who I am going to send my survey to. So assuming that you have a sampling frame, you send it to the people in that sampling frame. If those people do not respond, what do I do? So the professor said, you still have to email them and follow up and say, please respond to this questionnaire. Then the student said, okay, if I've done that like 2-3 times and it's on borderline harassment, what do I do? Do I exclude them? Are they missing data? Or can I actually replace them with someone else? The answer is do not replace. Okay, because if you replace them, that completely destroys the effect of the probability sampling. Okay, so he said if you target at 350 and somehow 50 decided not to respond, then you actually have a response rate of 300 over 350, and you convert it into a percentage lah. What is 300 over 350? Yeah, 300 divided by 350 equals 85%, 86%. Okay, so in your thesis, this is the thesis stage. In your thesis, you also have to declare your response rate. This is for those who are doing survey research using a questionnaire. So you have to declare your response rate to tell people, I targeted 100%, obviously, but I only got 86% back. So you would have to find a reference that says 86%, even though it's lower than 100, it is still sufficient for you to say, I found this and this and this. Okay, so meaning that your study design and your data collection and your final sample size is still sound and still valid, and it still has an integral property that will show people who read your thesis that your findings are still reliable and still valid. Okay, so that's why you factor in this to 10 to 20% so that you can try to get at least close to 100% response. Right. Next one, we talk about variables and operational definitions. So in observational study designs, you always have an exposure, you always have an outcome. So make sure that you define them properly. So earlier, somebody mentioned when we talk about smoking status, there are people who are smokers. In other words, they actually do smoke. And then there are those who are passive smokers. So you have to come up with a specific operational definition that gives people a clear idea about who you are focusing on. So if you're talking about cancer, perhaps you want to specify which stage cancer. If you're talking about exposure, then you have to define what is considered an exposure. Is it only passive? Is it only if you're, was it smoking or whatever definition? So make sure that you define them because that will also tie in with your eligibility criteria as well. Data collection procedures, I'm not going to go into too much because it's very unique to every study design. So you identify what are your data sources. So if you're not collecting primary data through surveys or observations, then you would have to access the secondary data sources through medical records registry. So you have to mention what records you're accessing and how you're going to access them as well. And also the data collection process, would it be solely you collecting the data or will you be outsourcing to trained enumerators or other researchers? Okay, obviously it's always best, and I say this for those who are doing, because I don't know if there's any qualitative researchers here, but if you're doing qualitative research, just a simple note, because I'm a qualitative researcher, but if you're a qualitative researcher, please collect your own data. Please do not outsource to anyone if possible. For those doing the survey research, if you want to get some assistance for employing, I don't know, if your supervisor has an RA or a undergraduate student to help distribute the questionnaire, going door to door, that's perfectly fine. But make sure it's you analyzing the data. And then also mention your data analysis plan. So that's a part in the last part in your research methodology, where you tell people for each research objective, what type of analysis you plan to do. So it's the practice with FYP, undergraduate students, we usually ask the student to tabulate. So the first column is each research objective, whether it be 2, 3, or 4. And then the second column would be your analysis, whether it be descriptive or it would be analytical. So like I mentioned, if your first research objective is determine the prevalence of disease X, then your descriptive statistic would be like mean or, sorry, not mean or perhaps frequency or percentages. But if your research objective implies that you are looking at relationships, correlations, etc., then specify the test, which would be like t-test, ANOVA, Mann-Whitney, Kruskal-Wallis, correlation analysis, regression. Okay. If you are looking to include confounding in your studies and to address them as well, then you have to mention what type of confounding control you will employ. So usually this is at the analysis stage. So you may do something like stratification or multivariable regression, but if you're doing it in a case control, then matching would be your best approach to reducing confounding. Also, you can mention the software. So people often say SPSS version, whatever it is. I have a very old version. My undergraduate students have like super latest one. And also mention your significance level, which is usually 0.05. But I have seen people in the medical discipline where they employ a much more higher significance, which is like 0.01. So again, discuss this with your supervisor. The last thing is ethical considerations. So make sure that every proposal you get ethics approval if your study involves humans. Okay, so they will be able to identify on proposal if your study has any ethical ethical implications or may have any potential harm to the participants that are part of your study. You may want to include in your proposal as well things like informed consent, the form itself, or even information sheets. Attach that in the appendix of your proposal. Talk about confidentiality. So the standard is usually all data will be protected, will be only used for publication purposes. Participants will be anonymized or given pseudonyms, etc., etc. So things like that you include in the proposal because people want to see what kind of ethical precautions you are taking to ensure that there is no harm caused to your participants in the duration of the study. And last but not least is the last part of the proposal, which is limitations and potential biases. So this can't remember what the specific section, I think it's limitations, but you can declare in the very beginning what kind of bias and confounding may appear in the duration of your study. And that will imply that your study is not 100% foolproof, but you have chosen to take some mitigation to help reduce that bias and confounding. And I emphasize on the minimization because you cannot eliminate bias at all. So you just have to be very aware of it and be very careful. So please consult that website. I think it was bias.org. I can't remember, where it has all the biases. But in epidemiology, there are specific biases that they consider, things like misclassification bias, measurement bias, selection bias. These are very, very common in epidemiological studies. Okay, so that's it from me. I have 10 minutes left. So I don't know if, is there time to do a consultation or anyone wants to raise some questions in the last 9 minutes?
Mashallah, you explained it so well and it's very informative. I really enjoyed your lecture.
So you're not
Morning
scared
lecture
anymore,
was
right, Nadia?
awesome, and right now it's really awesome and clearing each and every part of everything research methodology. Thank you. Jazakallah khair.
You're very welcome. Thank you very much. Anyone want to take the opportunity? If not, again, my email is free for you to use to consult. Miss Chairman, nak stop sini ke ada soalan? Kalau tak, kita boleh habis awal before Prof Mat. Prof Mat ada lagi kan lepas ni?
Ya betul. Station
Oh,
Prof
okay.
Mat at 3:15.
Okay. Kalau macam tu, maybe it's best if they have a 5-minute rehat time lah.
Okay.
Okay, all right. So thank you very much. I wish everyone the best in your studies. Just remember, it starts off very well in the beginning, very promising, but do not be afraid of changes. So if you feel like that you have to adjust because of challenges that you met along the way, that's very, very normal. Even titles change, even research objectives change to suit the resources that you have, the time, etc. So don't think that when you propose something, you have to stick to it to the T. It can, basically, I tell people it will evolve. So don't be afraid of that evolution process. Okay? All right. So thank you, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam, Doctor. Thank you.